Good afternoon, everyone. If you're just tuning in, I'm Madeline Moulika, President and CEO of APEX, and this is our last panel for today for the APEX Legislative Leadership Summit. I am honored to be joining such a distinguished panel on a conversation which is so timely during our recovery through this pandemic, a discussion on AA NHPI, food insecurity and food access. As a friendly reminder, if you have not yet visited our exhibitor booth from all of our wonderful sponsors of the Legislative Leadership Summit, please do so. They have some wonderful materials that you can download, and I highly suggest that you take a look at them. Before we begin, it's my honor to introduce Congressman Kai Kahele for opening remarks. Congressman Kahele currently represents Hawaii's 2nd Congressional District. And before serving the country as a congressional member and in the armed services, he was a commercial airline pilot with Hawaiian Airlines. We're thrilled to have him join us today. Please welcome Congressman Kahele.
Aloha kako. I'm Congressman Kylie Ikahele of Hawaii's 2nd Congressional District. And it's my great pleasure to welcome you all to this APEX panel on Asian American, Native Hawaiian, and Pacific Islander food insecurity and food access. Access to healthy, nutritious food is a critical issue in the Hawaiian Islands and across the United States that we must address to improve the well-being of our people. This topic is very personal to me as I reflect on my formative years when, as a keiki o ka'aina or child of the land, I would watch my kupuna, my elders from Miloli'i, Hawaii's last remaining fishing village, harvest their offerings from the ocean and land. The ocean was our refrigerator, and the fresh fish we caught provided nutritious, healthy food for our families. This taught me early on about the values of malama honua, malama ina kanaka, and malama kino, caring for Mother Earth, caring for our community, and caring for oneself. At the turn of the 19th century, Native Hawaiian traditional diets began a transition from fresh fish, taro, fruits, and vegetables to high cholesterol, sugar-laced, nutrient-deficient, salt-rich processed foods. This has had a profound impact on the physical, mental, and spiritual health of Native Hawaiians, an effect that may also have traversed to Asian Americans and Pacific Islanders. For Native Hawaiians, a disenfranchisement from ancestral lands and the ocean led them to living in urban settings, where canned and packaged food became the primary staples at mealtime. The processed foods hastened the onslaught of premature death from obesity-related diseases such as diabetes, high blood pressure, and heart disease. These problems have not gone unchallenged. In Hawaii, the growing awareness of connections between a nutritious food diet and physical, mental, and emotional well-being has caused a rethinking of our relationship with surrounding ecosystems. In this vein, it has energized an entrepreneurial spirit to rebirth farmer to consumer nexuses. And while the movement began before the COVID-19 pandemic, the past year's shutdown spotlighted system deficiencies and human ingenuity took over to solve problems. Today in Hawaii, we call it Aina Aloha. More, however, must be done, as evidenced by a recent study in March conducted by the University of Hawaii. Data found that 48% of Hawaiian families with children are experiencing food insecurity, with 15% reporting that they did not have enough food in the past week. More concerning is that about 76% of these families reported inadequate food insecurity had lost employment income due to COVID-19. We know that lack of access to high-quality food has been a persistent issue in our community that has been historically overlooked. But amid an unprecedented pandemic, food insecurity and lack of food access have been magnified. The need to provide nutritious food for AA NHPI families has never been more critical. As national leaders of this country, we must come together to expand SNAP, WIC, and other nutrition programs for children and seniors to solve this critical problem. My hope is that this panel will generate ideas and potential solutions to addressing food insecurity and food access for AA NHPI families to grow a more diverse and sustainable economy. Mahalo nui loa for your work to improve the well-being of Asian Americans, Native Hawaiians, and Pacific Islanders. Mahalo.
Thank you, Congressman Kahele, for your leadership and for bringing such important topics to the forefront of this conversation. Before we actually start this conversation, I would like to acknowledge that we are using the acronyms AA for Asian American and NHPI for Native Hawaiians and Pacific Islanders in order to ensure that all of our communities are represented. Before we start, I really would want to set the tone on the context on this. To some, when you talk about food access, they don't envision an Asian American face in lacking in food security. If you're a member of the AAPI community, you definitely see it differently. So let's break down some numbers. In an op-ed written by Dr. Teresa Mock in Civil Eats, she wrote that in 2020, Feeding America, a national network of food banks, estimated that 45 million people and 15 million children didn't have continuous access to healthy, nutritious food. And oftentimes, Asian Americans and Native Hawaiians and Pacific Islanders are absent in the narrative about these issues because government entities such as the Department of Agriculture don't include AA NHPIs in their ethnic breakdown, such as the case of a summary that examined food insecurity by race and ethnicity from 2008 to 2017. It's an issue of data disaggregation, as well as the model minority myth that has been exacerbated by the pandemic. COVID-19 increased the jobless rate. A recent study from UCLA noted in Dr. Mock's op-ed highlighted that Asian Americans had a jobless rate of 21% in 2020 as compared to 16% for white Americans, and it reached 25% in New York City. This issue has become even more acute for our most vulnerable, the elderly, low income, recent immigrants, and the undocumented. The issue of anti-Asian hate is an added factor with people being fearful of leaving their homes. And as a result, you have a number of local nonprofits that have been distributing food for the first time since March of 2020. So today, joining us for this discussion are a wonderful group of people who are doing the work every day in supporting our communities. Let me please welcome Melisa Laelan, Marshallese interpreter and commissioner at Arkansas Minority Health Commission, Moulika Hitchens, Community Food Systems Manager, Health Promotion at Waianae Coast Comprehensive Health Center, and Winston Chiu, founder and CEO at Feed Forward. So thank you for joining us today for this very timely discussion. So let's talk a little bit about how the pandemic has made food insecurity issues worse for the API community. Let me start with Melisa on that. Melisa, unfortunately, we can't hear you.
Can you hear me now?
Excellent. Thank you so much.
Yeah, I think people fail to realize that even prior to the COVID-19, we were experiencing a lot of food insecurities all over the nation. And I'm really glad to hear those data that you just mentioned. And I think a lot of that has to do with, the livelihood of AAPI families. A lot of our families are really, making barely the minimum in terms of employment, and I think that contribute to this as well. But COVID-19, when folks started to lose employment and lose hours and things like that, and also other issues with housing, a lot of our families had to, pick and choose whether they should pay the rent or put food on their table. So I think there are a lot of long issues that exist even prior to COVID, but I think COVID really just brought that up. And in a way, unfortunately, COVID really was horrible and kill our communities, but at the same time, it did kind of shine the light on so many issues around food insecurity.
Thank you for sharing that. And especially since you're in Arkansas, where we don't tend to think that there are APIs, in rural areas such as the southern states. So, I think having you on this panel really highlights that this issue is affecting APIs across the country, not just in areas where we think of, an urban setting. Moulika, I'd like to ask you the same question, and especially since you are in Hawaii, how that affects you differently in a place that isn't, part of the mainland, and food is very different on the island because it is the island.
Yes, I agree a lot with Melisa. Prior to the pandemic, a survey was conducted amongst our patients, and 40% reported that they were food insecure, which was the #1 priority. And being in Waianae, if you're familiar with, we're isolated as an island, first of all, but Waianae is isolated on the island of Oahu because we're on the far west side, leeward coast, and basically there are not many jobs out here. So a lot of community members have to travel 3 hours, commute just to go to work low-wage jobs in the service industry. And obviously, we know tourism was greatly affected during COVID. And so it just exacerbated the issues with food insecurity. And, now the keiki are home. So kids are home. They're not in school. And the adults are either furloughed or lost their jobs, and you have multi-generational households living together. So it really just, with the loss of jobs, folks are home now. It just really exacerbated the situation.
Well, thank you for explaining that to us. And I know with Winston being in New York City, a very urban area, I think a lot of people were very surprised to hear that there was food insecurity in such an urban place. Can you expand upon that and talk a little bit about how the pandemic has made this worse?
For sure, thank you. So coming out from New York City, in the past year, I had established a previous organization called Rethink Food, where we worked on excavating excess food over the last 3 years. When COVID hit, we knew that restaurants would close and supermarkets were also closing shortly behind them, particularly in the Chinatown area where most of our API throughout Queens, Brooklyn, and also in Manhattan. We saw that because of the restaurants and the businesses that were attached to the community were supportive, we looked at food access and food utilization as two parts of the food insecurity spectrum. And with the restaurants closing and the marketplaces closing, a lot of majority of our seniors that live within these areas, which we estimated about 20 to 30,000 just in the Manhattan Chinatown alone, they were facing food insecurity due to access. There were no markets were open. We had one restaurant that was open throughout serving the community. So our organization brought in about 10,000 meals just the first day. And we were thinking, oh my God, there's going to be so many meals that are left over. With our surprise, I think, within 30 minutes, these lines formed and all the food was gone. And there was only increasing demands throughout the time. To current date, we're still serving about 12,000 meals door-to-door delivery. And there only seems to be more and increasing needs due to, unemployment, due to the fact that our businesses within the Asian communities are closing. They're finding very hard, they're going through hard times in terms of just being able to sustain themselves. But also at the same time provide for the communities. One thing that only the Asian hate crimes have been increasing has forced a lot of the seniors to stay at home due to the fear of being attacked or the fear of just being out. So we're doing what we can to continue to assess the situation, figure out who are in need of services, but at the same time, how do we also support our businesses to make sure that they're thriving, so that they continue to become a lifeline for those residents that live there in the respective Chinatowns.
Yeah, I remember when the start of the pandemic in 2020, when people were trying to encourage others to frequent Chinatown in itself. And so I know that a lot of the Chinatowns across the country were already feeling the pandemic before the shutdown started. And so, I'm glad that we're able to see some of these businesses reinvent themselves to be able to service our communities that way. And so, I really applaud all the work that's been happening with all the nonprofits who've pivoted to be able to service our most vulnerable. Melisa, being a commissioner on the Arkansas Minority Health Commission, you must see a lot of this in terms of the disparity across all of our communities, especially when you think about age and income. Some of these segments are probably more hard hit than in others. Can you elaborate a little bit more about how that in food security has affected those populations?
Yeah. Well, I am an ex commissioner on the Arkansas Minority Health Commission 2 years ago. So I do have a role within the nonprofit sector, that specifically the Arkansas Coalition of Marshallese, where it's really the kind of like the main PI population in Arkansas. But I think with particularly the COFA population here, we've seen really like the worst side of the COVID. You're talking about a community that really had no access to basic programs, things like the Medicaid program. For 25 years, the COFA communities really fought hard for that. So that compounded with equal access to resources, and also have lack of access to the SNAP program here in Arkansas, where Marshallese and the COFA citizens do not have access to it, really made everything just worse than ever. So I think when you look at the population here, it's a very small, tiny number. However, we did experience a disproportionate impact of COVID-19. And that's not, I also want to say that it's not just food access, right? It's also things like housing needs, or even, legal status. A lot of that, if you put all of that together, we saw a lot of families that were in dire situation because of all of the above. And I think it's very important, and as you had mentioned earlier, of disaggregating data, AA NHPI, we need to, in order for us to understand specifically what each community is experiencing, then we need to disaggregate data, because I think that's the only way for us to see the real story and of disparities that are happening. Can you? I'm seeing that. Can you hear me well?
Yeah, I can definitely hear you.
Okay. So I think.
Go ahead, please, Melissa.
Can you hear me? Yes.
Yes.
Sorry about that. Yeah. So going back to answering the question, I think they're just, when we're talking about food access, you cannot just talk about, inventory or supply of food. You also have to talk, think about lack of access to healthy food. With NHPI communities, we often find that we're really having issues with accessing food that are healthy, low fat, low sodium, and things like that. Also, the fact that oftentimes there's no option for the community to have access to cultural food, right? Things that are that we're used to and very healthy. So there need to be this sort of this community-led solution that we need to think about.
That is so right. I think the one thing that we don't often think about too, when we think about, food access, is what you mentioned, having sustainable, healthy food that is also competent, then culturally competent to the people who we're delivering that to. And so Winston, I want to check if you can hear us, because it still says you can't hear. So I will pass the mic on to Moulika until you can hear us, and ask, with that, being, Congressman Kahele talked a little bit about how things changed in terms of the diet and the cultural aspects of food, and how the importance of food is a part of our identities as, our ethnic identities. So how, in terms of food access, have you been able to provide that for, the clients you service?
Thank you. Yeah, so So just a little background, Waianae is a community of a little less than 50,000 members. And we also have the largest population of Native Hawaiians in the world. So with every program that we design and develop, we really think about what, prior to all of these health disparities, how did people live prior to that? And what were they eating? And why were they so healthy? So with every program, we include cultural foods like poi, which is a starchy traditional food made of taro. We offer keiki, kids and kupuna meals weekly at 14 different distribution sites, and we get feedback from the community. So we're not just putting out like sandwiches, right? So we're putting out stir fry, chicken luau, so stews made out of taro leaves, meals made with breadfruit, ulu, sauteed ahi, local catch fish. So we know that, we don't want to just provide food just to fill the calories. We know that food is medicine, and cultural food is even better medicine than that. And so we really take that into consideration when we develop these programs. Yeah. Sorry.
Please feel free to continue.
Oh, I think I lost your last part of the question.
It was really, I think it's really, we want to be sure that, when we talk about food access and being able to deliver or provide food, how is it that, I think with, quote, mainstream organizations that are nonprofits that are trying to just provide food access, that our communities, when we are very focused on, the cultural identity of these communities, that we are actually providing them, more cultural competency because we're providing food that we know that's healthy, that's a part of our, original diet. And it gives us, an opportunity to, keep people healthy versus just giving them things that may not be nutritious, but has calories and keeps them alive, but not in a healthy way. And I do want to note that you and your team led emergency food distribution efforts that resulted in over 300,000 meals served and over 3 million pounds of food distributed to over 36,000 households in a year. And so that in itself is an amazing feat, considering you're keeping everything culturally competent with the clients that you're servicing, which doesn't necessarily happen.
Oh yeah, it's definitely a lot of community members coming together, a lot of partnerships, a lot of feedback from the community as to what they want. And also, as a health center, we're very proud that a little over 50% of our staff is from the community. So the folks behind the scenes are people from the community. And I think that makes a huge difference. Not only, prior to COVID, we weren't in the business of emergency food preparation and planning. We were running farmers markets, community wellness workshops. We also have a keiki, so a kids produce prescription program, where our pediatricians are actually prescribing fruits and vegetables to keiki. And we just started a ohana produce prescription program. So adults with chronic illnesses, they're able to get these gift certificates and shop at our farmers market to purchase foods that they and their family would eat. So it's really a different, for a health center to be really in the forefront of providing good food is something that is more healing than just what happens in the clinic walls.
All amazing things, and all the things that you've suggested, I think, are solutions that other organizations can take into heart when they start to think about the clients that they serve. Let me also just remind the audience, please feel free to use the Q&A section of this panel to enter in any questions that you would like to ask. Winston, I want to go to you. I'm glad that you can hear us now. Unfortunately, you weren't able to hear some of Moulika and Melisa's suggestions. They talked a lot about servicing their clients in a culturally competent way by providing them food that is a part of their cultural diet. And what they really did was offer solutions on how you can get nutritious meals. So my next question to you really is, what do you think are the biggest barriers when it comes to ensuring that the AA NHPI our families have access to high quality, nutritious food?
I think that's a great question. What we found to be the barrier to access was representation. I think representation that we see, within government and seat holders that actually determine how food access or food is being distributed. A lot of the food pantries that we saw down in Chinatown or in the Asian population were simply serving things that were not culturally sensitive. Things that were peanut butter jelly, things that were, consisting of high dairy. That large part of our population is lactose intolerant, and I think when we saw that, we just knew that we had to activate or at least get players into the seats that are driving how food access is being distributed. So enabling restaurants was a huge part of our model. That we took local restaurants, paid them to be able to cook the meals that we knew that those that were receiving it were able to resonate with. So a huge part is how do we represent and make sure that we're having seats at the table to continue to have the conversations as, what are the types of food that we serve, how are we serving them, and making sure that, even language barrier acts that prohibit us from even receiving some of these benefits or understanding that these benefits are available to our communities. So making sure that we enable budgets for nonprofit organizations that are doing the work to not only serve the community, but also understand the community that we're serving. So a lot of the work that we did was making sure that we worked with local community-based organizations that gave us the ability to create these relationships, foster the relationships, but also continue the conversation so that we can better serve our community, particularly in the Asian community.
So that is actually the same kind of point that Moulika had when she talks about her health center having community folks actually be a part of, the work in servicing our families here. So I have to say is that I'm glad that you left your actuary job, because you're definitely, bringing forth a lot of good ideas working in the culinary industry. So, thank you for doing that. I'm going to turn it over to Moulika, back to Moulika. Again, you've kind of addressed a lot of barriers that you've overcome. What do you still see as challenges for you?
So Waianae is actually in a designated food desert, even on the island of Oahu. So that in itself is very challenging. There are not many grocery stores, and the grocery stores that are here are set up in a way when you walk in, you're met with the liquor department and you're met with candy and snacks. And so the built environment is really not set up to, help someone become successful and live a healthy, strong life. But also stems back to plantation days. So there's a deep history of, just racial issues with, this was this is a place where plantation workers lived, and, we were the first health center. There just wasn't much access out here. So prior to the health center being here, folks had to travel hours just to seek healthcare. But that being said, but there's also like tons of fast food restaurants. And so the options are very limited in Waianae. And I feel like that is a big barrier. And like I said earlier, there are people who commute 3 hours a day just to work 2 or 3 jobs that are minimum wage. So when you're commuting and you're barely making ends meet, it's really hard to think of, how do I create this healthy meal for my family when the kids are about to go to sleep? In Hawaii in 2019, for a family of 4, if your income is $96,400, that's considered low income. So it's really hard to, housing. We have housing issues, right? So food is just another one that falls into that category. That if you're making low income wages and you're living in the food desert, it's really hard to have access to high quality food.
Thank you. Melisa, being in Arkansas, you think about the state is a little bit lower on the scale of, education and healthcare. How does that affect, along with all the food insecurity that goes with access, how does that affect the Marshallese in your community?
Could you repeat the question again? I was having a little bit of issue with my headset. Can you repeat the question?
Sure. So my question is, some of the challenges that you see in Arkansas, being that the state itself is generally overall on the lower end of, education, healthcare, how does that also affect the Marshallese in your community?
I think what you're seeing in the general population in terms of, low, being in the low spectrum in terms of education and things like that is even worse. I really think it's even worse because this is again, and I think someone mentioned, equal access to resources. Just simple fact that it is an immigrant community. There's going to be a lot more other things that come with that package, and that goes to wages, low income, affordability is a big deal, right? And that's why we're cannot have access to healthy food is because of they cannot afford. They just simply cannot afford the healthy food. And also, what we're also seeing is education. We're seeing, and I think you brought up, new immigrant. Especially the Marshallese community here in Arkansas, they are newcomers into the state. So, it's really coming from a different culture to another new world, and that including the things that will take a lot of time to learn. Because of the food choices are changing now. You have to learn how to cook these new food that you're now seeing. So, education, cooking class is very important. Gardening, where you be able to raise a lot of, or grow a lot of healthy food. Another thing is policy. Policy is a big deal for us here in Arkansas. Marshallese do pay taxes just like anyone else. However, we're still restricted to programs like the SNAP programs and things like that. So, and also navigating in general, language issues, that could be a problem, and that could cause you to not be able to navigate the entire system with confidence. I think it's worsened if you're thinking about if you were to compare it into the general population. I think it's even worse.
I think, all the comments that you've made in regards to, making sure that, when you think about Asian Americans not in, lower economic income status, that in itself is something that, we are all trying to dispel, in that model minority myth, and that we're not crazy rich Asians. This is also part of that, data disaggregation that also comes into play when you're trying to also showcase that newer immigrants who tend to come from Southeast Asia or as you also mentioned, Melisa, with the Marshallese, that they are also struggling with changes of becoming new Americans, and that there's a widening gap between those who are established here and those who are not. And I think the more that we can dispel the myths that people have put upon our community, that we're not a monolith, it will help to better understand how to address those needs. And so you mentioned SNAP. I think also I'm going to throw this question to Winston, being that, again, New York City, you tend to think of it as being such an urban setting with so much possibility. When we talk about those types of benefits, there's also probably some, cultural hesitation from our community to accept that there's these resources. Winston, can you talk a little bit about how we can encourage more enrollment of our community to take, advantage of these resources?
Yeah, for sure. So one thing that we understand is that in the Asian population, we're probably the lowest of the minority groups that are enrolled in SNAP. I've been talking and working with this group called Fresh EBT, which they created a technology app that allows SNAP recipients to onboard and see their statements. And through that conversation, realized that only 2% of their users, whether it be technology prohibiting or just the real indicative of the real population, only 2% of the population is signed up to SNAP in New York City through their app. So that kind of shows us the sign of how many people in the Asian population are utilizing the SNAP benefits that they have access to. I think it comes to the stigma of receiving a handout, the dignifying aspect of how do we actually utilize these benefits and integrate them into a system that is more dignifying. So something that we've done at Feed Forward is actually taking these benefits and integrating it into restaurants where people have the ability to actually purchase items through the restaurants like a normal customer. And I think ideas of saying that these benefits are here to help our community. We should definitely help in foster enrollment, as a lot of the ingredients and the supply chain in the food industry is increasing. It's due to limited demand, people needing to make up their margins for the lost year. So that as prices of ingredients are increasing, we want to make sure that people still have access to nutritious food, and they're not moving towards a starch-based diet and still promoting a protein and plant-based diet that we know that they need. So filling in that gap. So how can we encourage them by looking at innovative or inventive ways to help push the benefits through the system in a way that we can support our businesses, support the community. And most importantly, we need to be able to, put the pressure on the policymakers, which I think we're going to touch base on later, to make sure that the aid that we're receiving, which is in this case SNAP EBT, is going to be reflective to our businesses and our community, and making sure that we find them useful. We need to be able to use them through our markets, through our restaurants, and through our other small business services that are going to help, continue to feed our community.
I mean, I think it's so interesting also a statistic that we have where most people probably don't ever think about the Asian American community specifically is, 1 out of 4 Asian Americans are living in poverty in New York City. And I think most people are very surprised when they hear that, just because, again, going back to that model minority myth. Moulika, I want to ask you, how can we, all the things that you're doing, I would like to see, in terms of, government programming being able to sort of take on a more holistic approach to, meeting people's nutritional needs. How do you think we can incorporate some of that into some of our government programs?
Yeah, so as being the state's largest health center, we are very blessed to be able to roll out a lot of programs that are not typical in other health centers. So we actually own and operate farmers markets, and we're the first on the island to accept SNAP at a farmers market. And we also started our own doubling program, so the call it Double Bucks program. So for every $1 of SNAP, we match that. So we match up to $20 of fruits and vegetables, poi and honey, and up to $20 of local meats, dairy, and eggs. And of course, what we're focusing on is not only nutritional food, but also local agriculture. Hawaii imports over 85% of food. And, in a place that has a year-round growing season, it just doesn't make sense because we didn't import food prior to, this whole plantation era. So with that, we're also, so during, just a little background, in Hawaii, in Waianae especially, we had the highest positivity rates in our communities. We have, in our patient demographics, we serve 48% Hawaiians, 12% other Pacific Islanders, and 13% Asian population. So we had, while the rest of the state was maybe at 1%, 2% positivity, we were at over 10%, 12%. So we had to close down our farmers markets, and doing so, we focused on emergency food distributions. But now that we reopened, we're actually offering unlimited doubling. So we had a cost savings from not having, open the market during the year. So we're offering unlimited doubling programs, even for PEBT, so the pandemic EBT that the keiki are receiving when they're not in school. So I think it's a win-win for us as a health center to ensure that our patients are eating healthier and they're having a way to eat healthier by providing these additional benefits for SNAP. Prior to the pandemic, 33% of our patients did receive SNAP, and among that, 55% of keiki living in households are also SNAP recipients. So we don't really have the same stigma, maybe as in other areas of the continent. So yeah, it's a little different in Waianae.
Well, it was great to hear that you're able to reopen your food farmers markets and be able to, be back in that situation. I think it's, one of those things that we've all learned from our communities that, we are pretty resilient. And I think this is, how we've learned to adapt to be able to, continue to still service, our communities in ways that will benefit them. Melisa, you talked, again about SNAP for your situation. We also, undocumented Asians are also ineligible for government assistance. And so when you think about, 1.2 million undocumented immigrants, 1 out of 7 are actually Asian immigrants. That's a number that most people don't know about. They don't think about us in terms of us being the highest, we're the fastest growing demographic due to immigration. So when you think about that, how does that affect your work, Melisa, when you're working in with the challenges in front of you?
I think we had to really think smart. We had to, you have to, and by the way, that is that's very very informative, the data that you just shared. But you have to make whatever program that you're doing accessible. I really believe in understanding what's around you, what the need of the community is, and try to do your best to tackle those needs. I think there need to be something that nonprofit, especially food pantries. We do, by the way, our organization is sort of like this wrap around organization. So that means we provide services that is very holistic. So it's not just direct service. We also have our own diabetes prevention program. In that, we provide cooking classes. We provide gardening lessons. We even have our own food pantry. We because of COVID-19, what COVID-19 did really open our eyes and force us to be innovative, right? So we did a community need assessment. And I think it's very important for us to listen to the community, right? Not just, like you said, the undocumented, documented, I don't care. We need to listen to what the need is out there, and you need to figure out a solution. It's a community-led solution. And I think, based on those assessments that we did, we immediately went into action mode. We immediately went into, okay, how are we going to identify these things and who are the funders? And because we already have a great relationship with a lot of our funders here, i.e. The Walton family or the Walmart Foundation or Tyson, and which all of them are really supportive of their, especially Tyson. It is a poultry industry, and it does help with food insecurities. So I think you need to sometimes we fail to look at the overall need and think about immigration status, instead of just addressing what the needs are. So what we do is we don't require, when we do our drive-through, especially around Thanksgiving, we had almost probably close to 1,000 vehicles that came through. We did not require any IDs. We just let them in. It was a very emotional moment because we had so many undocumented families that came by, not just Marshallese, not just Hispanic, but also AA communities that we saw. So it was rewarding to see that and to know that, that those families are going to be fed on Thanksgiving.
Such great work. Thank you so much. Winston, I'm going to throw that same question to you, considering that there are nearly 167,000 undocumented immigrants in New York City. So, how have you been able to overcome some of this and trying to help some of those folks in this situation since they can't access government assistance?
So primarily we work with community-based organizations that target or at least assist undocumented workers, whether be in the Asian community or Hispanic or Black community. We know that there's a lot of our workforce that's undocumented in some of these areas. So what we've done is either provide them meals. That's why we consistently still provide meals in the communities for those that need it, given that the city is opening back up. So with that, it's really figuring out where these populations reside. A lot of them are now homeless, and there's a huge homeless population in Chinatown, which we still have a lot of organizations that are bringing out food and distributing food to the homeless population. And in other areas, for those that actually are undocumented, there's small business or family associations where we're able to actually connect them back to their associations that either get them a hotel and food assistance and work from there. But it's really finding and figuring out where these pockets of people are residing. Either they lost their jobs, are unable to get jobs, are now homeless, but also have issues in terms of receiving a nutritious meal. So we don't really necessarily categorize. We just, at this point, we look at the people that need meals, and most often, more than not, that they are part of that population that are requiring a meal. One thing that we're trying to be cognizant of is, as we're opening back up, to understand that there's still a lot of awareness that needs to be built towards our community, that the assistance is still there, the demand is still there, so that this is not just a COVID thing. We understand that our communities are continuing to hurt, and due to what we're seeing today with the Asian hate crimes, we know that there's a long road back to recovery for us, and making sure that our businesses are still thriving and not falling under the pressures of paying rent, the increasing food prices. We don't have, as Moulika and Melisa has mentioned, we don't have farmers market that serve our population. Our farmers markets are the small markets and grocers that are living within the Chinatown area. So we need to make sure that they survive, and that even that they have access and are updating their businesses to be SNAP eligible, so that they're receiving these benefits, but also the revenue streams to keep their businesses thriving. But long story short, I think the homeless, whether it's the homeless population or the undocumented population, we just know that there's a great need for food, and we can first stabilize by bringing food in, and then from there identify what the individual needs are, whether they're low income, seniors that need special meals, where they fall into the categories of diabetes or obesity, and kind of categorize from there on. But we don't particularly categorize or label. We just know that right now there's still a big demand for food.
I also want to just note too that this is all integrated into so many things that we are seeing. And the pandemic only just sort of opened everything up in some ways for people to understand the diversity of the community, the economic disparity that's going on, the lack of data disaggregation. All of that really is a highlight of what's been happening within the community for a very long time, and now it's just kind of opened up our stories a little bit more, and so now that we have this opportunity to really tell people our stories, how do you think we can have policymakers listen to our stories, especially those in New York? You have Congresswoman Grace Meng, In Hawaii, now you have Congressman Kahele being the second Native Hawaiian to be back in Congress after Senator Akaka. I mean, these are, great advocates for our communities when they talk about, the cultural competency and sensitivity. How do we do this with other policymakers who may not understand our stories? How do we explain to them what we need? Melisa, I'll start with you.
I think we just keep telling the stories. I think we just keep telling the stories. That's very, very important, and do not give up. And even if you, and I'll use this for an example with the COFA Medicaid restoration in 1995. After the new welfare reform kicked in, COFA citizens, including Marshallese, were kicked out of the Medicaid program. So we didn't stop. We just kept going, and we kept going, and we kept telling the world what our story was, and also building. I think it's so important for the community level organization to form this alliance with national organizations like yourself, who have the power to bring issues that are impacting the community level up to the national and get the national attention that they need. So I think there's sort of this, more partnership that need to be created. Also, you need to keep telling the story. If you need to do an article, if you need to, to be vocal about it, and really, and also, and I mentioned this earlier, building those relationships with your congressman. I think is very, very important. That will never, once you build that relationship and form an alliance with your congressman and let them know what the real story is, I think that will open their eyes. We had that issue with the COFA Medicaid restoration. In Arkansas, there was never, there's a lot of, it's a red state. So we never had any buy-in, any support from any Republicans in terms of Medicaid and giving Marshallese access to Medicaid. But we just kept going, especially COVID. When COVID hit, we just kept having, scheduling meetings with WOMAC. And WOMAC actually became the first Republican ever to support COFA Medicaid restoration.
Well, that just tells you about persistence, and also, the importance of coalition building, and, actually really, also too, talking to people who you think may not necessarily want to listen. And I think it's so important that we do talk to those who may not be seen as immediate allies, to be able to help educate them and make them more aware. Moulika, I want to ask you the same question. Again, you have a little different perspective, and I think also too, as you've noted, you are the largest health center in the state, so that does give you an advantage to be able to have influence. So how do you do this in terms of talking to your policymakers?
Yeah, so I agree with Melisa, telling the stories of the community. As a health center, we're fortunate enough to have data. In Waianae, we're number one in the things that you don't want to be number one in: obesity, adults with diabetes, diseases of the heart, cancer. So a lot of that, go hand in hand with food access and health and racial disparities. We are fortunate enough to be the largest safety net on this coast. And so we have partnered with major players like Kamehameha Schools, Queen Liliuokalani Children's Center, partners that have a lot of influence, but also are in the community as well. We also engage with our local representatives, Stacey Lynn Eli, Cedric Gates. They come out to our food distributions. They actually help pass out food. So fortunately, we are really deeply rooted in the community. And so to engage our legislators, they're already involved. And, it's again, I didn't grow up in Hawaii. I grew up actually in the East Coast. So to me, it's a very big contrast coming from Connecticut and living up and down the East Coast and coming to Hawaii, and just the spirit is there. It's a very different feeling. Where you see people rolling up, their aloha shirts. I mean, they're already short, but like rolling up and getting dirty and really, coming together. So we are very fortunate in that case. But, I really do agree with Melisa telling the story. And, if you have data to back it up, even better, being engaged, like we have a year-round growing season, really coming together. We work very closely with our farmers. We have, Waianae is known as the food basket of Oahu, but not a lot of food stays in Waianae. Prior to the pandemic, a lot of that food was going to Waikiki, going to, tourists got to eat the food that was growing in Waianae, and people who lived here didn't. And so we weren't okay with that. And that's why the farmers markets were started. And you'll see our local representatives walking around our farmers markets saying hi to community. So I think, again, I with the contrast of coming from the East Coast and being in Hawaii, I think community is a big part of it. And if community has a voice, and I feel like we really do, people making those decisions are listening and they've already been engaged.
These community-driven solutions, partnered with private public entities, really do provide us, some pathway forward. Winston, I want to ask you that same question.
I 100% agree, and I'm going to piggyback off what Melisa said. I think representation is important. We need to hold our voting accountable. We don't have the representation, then most likely the policy makers are not going to come down, and they don't take us seriously. So by having representation, we're able to drive the accountability and making sure that they understand that our vote counts. We're in a very pivotal year in New York City where, we have a mayoral race, but we also have a lot of city council races that make sure that we have the power to make sure that our vote counts and our voices count. I think unity is also, to that part is important. Amongst the Asian community, we have, so many voices and so many representations of different dialects and different people within the Asian population. So we need to be able to unify our voices, making sure that we have representation, but most importantly, that we are not fighting over each other just to find representation, because often we're either tearing each other down or fighting against each other to make sure that our voices go through. So, it's important to use our platforms, whether you're the young or the old generation. We all have a platform. We all have the ability to go out there and making sure that our vote counts, that we're participating within the community, and we're no longer sitting on the sidelines just watching. This is a time where we can unify our voice, unify the intergenerational aspect of the old and the young, and working together to make sure that we have more representation, we have more participation, and most importantly, making sure that all our voices are heard, and that there's not one single voice that represents the Asian community. We're a collective of individuals that come from many different backgrounds. That I know that if we come together and we can share our stories, through our platforms, that we can hold the policymakers, accountable. Just to share a story, like within New York City, our budget was $300,000 that was allocated towards the Asian communities. And working with our local representative, with Assemblywoman Lee New, she was able to actually get $10 million just due to us showing up and just due to the recent events to expand our budgets. So if we have more money, then that will give us a greater chance to activate our programs, but also activate the initiatives within our communities to help support our constituents.
So true there. It's so important to remember that, as much as APACs, we like to encourage people to run for office, we also recommend that people see that they have a voice through their ability to be subject matter experts and, be on a board or a commission, as Secretary Norma Netta has always talked about. So being active within your community, which all of you are, you're already leaders. I hope to one day see you all run for office. because that in itself is just another platform for how we see representation. And it's so important when we also talk about our demographics in the sense of our younger generation, making them feel empowered, that they have a voice in participating, that they have a way to organize themselves to, be a part of a, larger effort. And I think a lot of this also indicates to our community the unification that we have felt in some ways because of the anti-Asian hate that has come has been directed towards us. That this unifying way of support and being able to, be there for one another as we try to protect our most vulnerable. So, on top of all the work that you're doing, you're also, trying to make sure that people are staying safe while feeding, the clients that you service. Winston, we have an audience question for you. They want to know, have you seen an increase in people within the community applying for benefits after this current administration withdrew the proposed rule on public charge?
I personally have not, but just through our counterparts and organizations that we work with, we have seen an increase in participation and understanding that they are signing up for these types of benefits. So it's a matter of also using our platforms to one, translate and making sure that we're not there's not a lack of participation due to language barriers. So I think we're doing a much better job in terms of getting the word out there, translation services, but also being active, running through our platforms to voice that that we're also making sure that we're holding these city benefits or state benefits, having languages services on their website. So let's continue to push for that, and I think that as we understand what's available to us, it's only going to make sense that we'll be able to have our constituents be able to sign up for these services and making sure that they're partaking in it. I don't see why we wouldn't if we had these services available, and and there were no barriers to entry to be able to sign up for these services.
Melisa, I'll have the same question for you. Language access, it's also something that is important in making sure we don't have a unifying language as a constituency. So is that also something that's been helpful to you in terms of making sure that people can access resources?
Yes, and specifically on the SNAP program, we do have a designated staff who does help families, getting them, the U.S. citizens, especially the children, whom we can get them enrolled into the SNAP program. So, and that is, automatically that's language access right there. So, a lot of families are supposed to go to DHS office, but instead they come to ACOM's office. That's kind of like their first stop. And it's really good because we do have, again, we work closely with them with that one-on-one, relationship that you're forming with these families. And also we submit the forms to DHS. And so everything is really, up to us. And we do a lot of these connecting the families to resources. So I think language access, it's a big deal. But unfortunately, agencies and even sometimes government agencies do not see a value in that, and that's why we're here. We just got to keep letting agencies know, and we do let them know on a daily basis. You need to make sure that you have an interpreter or you have a translator who's available at your staff, because when you don't have that, families, it's kind of like a barrier for the families. And as an organization, it's our role to ensure that these families have access to those resources, and that's why we bring a lot of programs to our office, including the SNAP program, where we enroll families as well as healthcare enrollment. It's because it's already there, and staff is there, and the language is there, and they feel comfortable coming to us.
So we have another audience question. This one I'll direct to all of you because I think it's helpful for the audience to learn from the answers. How can non-AA NHPI organizations be allies for causes like yours? Moulika, I'll start with you.
That's a great question. There's so many ways. There's sharing the stories, sharing what we do. There's funding, of course. There's, it's just sharing, that doesn't take anything. It doesn't take money to do that. Uplifting the work that's being done, maybe redirecting funding. If there's a situation where an organization that is better well equipped to service communities like ours, then say something. So yeah, communicating and sharing, I think, is a huge thing.
Terrific. Winston?
I often look at this as, hunger, hate, or hate crimes, where it's not a race issue. It's a human issue. So the way we can support each other is to make sure that, we stand up for each other, speak for each other, and making sure that, we show up for each other. So whether it be, Asian community or the Black community or the Latin community, we need to be, in unity, making sure that we're all fighting for the same thing. We're all fighting for the right to feed our communities. We're all fighting for the right for safety, and making sure that under our communities that we unite and often have more conversations to know that we're more similar than we are different. And through our work at through my work at Feed Forward, is often doing a lot of work in the Asian community, but we also assist in the Black and Latino communities, but also in Caucasian communities, because they too often have constituents that are dealing with food insecurity. So I think food insecurity is a unifying theme. Anti-hate is a unifying theme, and if we look into the details of what we're asking for, it's pretty much the same thing. So let's promote the human race is probably my answer.
Building those coalitions are so important when we want to share. I mean, it's one of the things that we do here at APACS. We work a great deal with the Congressional Hispanic Caucus Institute and the Congressional Black Caucus Foundation. They do the same work as we do when it comes to representation. And we always try to make sure that we're doing things together throughout the year, our program participants, so that they learn from each other. We learn that, the Latino community, they have their stories, and we want to learn what their stories are, and as do the Black community. And so I think this is so important, and especially with all the social justice issues that have been happening in the past year, understanding each other, how we can best amplify our accomplishments and joy. At the same time, also understand how we have these challenges, and they might be unique to our constituency, and at the same time, very much very similar. So definitely agree with you on that. Melisa, what about you? What's your advice?
I think as Winston started talking about, you can support, support in terms of listening to what other communities are faced with this hate crime thing. I mean, you can support that in so many ways. You can call your congressman. You can if there is a bill, you can support those as well. And also, I always, in order for the community-led organization to be able to do what they need to be doing effectively, if you're a funder, I'm not ashamed to say we welcome your support. We welcome funding. So that way we'll be able to do what we need to do.
So we only have a few minutes left, and I really want to give each of you time to be able to really talk about, we want to end it on a positive note in the sense of, we see that this pandemic is hopefully wrapping up in a way that allows us to see more vaccinated people, our businesses opening, people getting their jobs. So I would love to hear what you think is going to be, a highlight of positive note of where you see our community is going post-pandemic. So Moulika, I'll start with you.
So during this pandemic, we partnered with various community organizations, and it really inspired me because organizations that work with water safety and children were out and involved feeding children. I think the community coming together, even with all the fears of COVID and all of that, I think that has really energized us, because our health center employs over 700 staff members, but our department was six people organizing behind the scenes and bringing people together from all different aspects. We had, teachers who were not working, obviously, come out. We had just kupuna, like the elderly coming out, and high school kids, really I felt like during a time when there was so much uncertainty, we did something. And I think that is really what keeps us going. And the fact that other people were coming out and, for our large food distributions that we hold monthly, we serve about 2,000 families. It takes 200 people to organize, to actually, pack the food and do the drive-through distributions. And every single time we had over 200 people wanting to volunteer without really putting the word out there. So I really believe in the people and community-led organizations, and just hope that, like when there's a lot of fears out there, there's also a lot of hope.
So wonderful to hear. Winston, what about you?
I'm just gonna piggyback off what Moulika said. I think this year has been a tough period for most, but it also has been an eye-opening period. And I think I want to take this window of opportunity to continue to urge people to remain hopeful, work towards the future that you want to build and the future that you want to see. I think we're in a unique time where, instances like these hopefully are, further out and we can look at them as a little bit more sparse. But this opportunity has really allowed us to see how much we can achieve in such a short amount of time and really move forward our individual conversations, but the conversations for our community as a collective, whether it's, due to having representation, whether it's, making sure that our communities are well fed, well educated, having the informational access, but also educational access. So whatever it be, any of those topics, I hope that we continue to push these conversations forward. And I know that at least at Feed Forward, this is something that we tie ourselves to in terms of our mission and our ability to make sure that we're continuing to bridge our communities, continue to share our resources, and make sure that we empower each other's narratives and that there is no one narrative. So thank you.
Excellent. There is no one narrative, empowering our narratives. Thank you so much for that. Melisa, what about you?
I think what COVID did to us is, it showed us our strength, and I think we just need to continue with those strengths. That we're resilient communities, that we can do it, and also foster those relationships. A lot of us has actually formed so many great healthy partnership with other organizations, other communities during the COVID-19 pandemic. So, continue those relationships and just keep going.
Thank you so much. All of you are each rising to the challenge. All of your organizations have met, such unprecedented situations for our community. And I have nothing but, gratitude and applause for each of you for all the work that you do and continue to do. This concludes our panel for today. I want to thank our panelists, Melisa, Moulika, and Winston, for joining us and sharing their knowledge and information. Please follow them in their organizations, support them as they work through this pandemic. We really want to be sure to have you all get to know their organizations and see the good work that they're doing. Tomorrow we will start again. It will be our last day of the Legislative Leadership Summit. Come meet us back here at 11:45, where we will be talking about diversity in clinical trials and health outcomes. And so we will continue learning more about the community that we all know and love. So see you the next time. Thanks so much.
Thank you.